people can't access the kind of medical health care they deserve, that they need, because of barriers in understanding what it means to be an autistic person in a healthcare environment. So even though I'm going to be talking about autistic experience in general, a lot of these things are relevant to healthcare. So I think first, the most important thing to know about people like my son is that they're wired differently. So that's what neurodiversity means. If you've seen Steve Silberman's book, Neurotribes, if any of you have read that, it's basically the history of autism and how autistic people have always been here. It's just that we are now able to recognize and recognize who they are, the diversity of ways in which autism presents in individuals, and that it's not necessarily a disease, right? So, and it's not a disease. So that's what neurodiversity means. When you talk to somebody like Steve Silberman, he'll say neurodiversity means not all great minds think alike. So if autism is not a disease, then what is it? Well, it's a disability. And so when you have a disability, what you need to function in the world are accommodations. And unfortunately, because autism is often perceived as a disease or something willful on the part of the autistic person themselves, these accommodations are too infrequently given. And I know that with my son personally, I have had a lot of difficult healthcare experiences, and I'm not alone, because even though I'm not sure how much you all know about autism, but there are various kind of schools of thought about autism as like a biological disorder in terms of being caused by leaky gut issues or all kinds of pseudoscience, when what's true about autism is that autistic people, like anybody else who has a condition or a disorder, there are a lot of co-occurring health conditions that can happen with autism, but that they don't cause autism. Autism is neurology. Autism is the way your brain is wired. So, and that kind of plays into the concept of autistic heterogeneity, whereas people, a common quote is that if you've met one autistic person, you've met one autistic person. You've probably heard that. But what that does mean is that autistic people, there are a number of common traits, but that doesn't mean that all autistic people are going to have them. So you can have somebody, for instance, who is intellectually gifted but also non-speaking. You can have somebody who is developmentally disabled but fully conversational. And so it really depends on the person. And so that's why things like functioning labels, like a high-functioning autistic person or a low-functioning autistic person, is not really helpful, because when you say that somebody is high-functioning, then everybody, for instance, like in a healthcare scenario, says, oh, well, what's their problem? Why can't they deal with this? Because you're so high-functioning, you can have a conversation. Obviously, you should have no other problems. So that means that their disability is actually ignored. And when then you say that somebody is low-functioning, like somebody like my son, well, watch out, because if you think that he doesn't know what's going on, then he's basically going to take you for a ride, because he's completely aware of everything that's going on around him, even though he's technically considered intellectually disabled and technically considered non-speaking. But he understands everything that's going around, and God forbid you give a piece of pizza or mention something that's going to happen later that you don't want him to know about, that's on you. So functioning labels are not helpful. So in functioning in general, being in the world in general, but also in the healthcare scenario, we really have to consider the autistic experience. So there are a number of traits that are not necessarily common to every autistic person, but they are very common with autistic people in general. So those are things like sensory processing, and the way that, what that means is that your five senses, hearing, seeing, touch, all of those things are either under-responsive or over-responsive. So for instance, it can be absolutely excruciating for an autistic person to be in a room that had this kind of echoing sound that we have right here. So they might need to have noise-canceling headphones to be able to function. So it also means things like they can see the fluctuation in fluorescent light in a way that somebody who's not autistic would not even notice, and it might make it completely impossible for them to function in something like a medical waiting room or in a medical office. So if you're trying to have an exam with somebody who comes in for some other medical condition and they can't even handle being there, the option is to provide different kinds of lighting or dimmer lighting, things like that. Auditory processing is another issue. A lot of autistic people have processing delays. So this is why, actually, I was just telling Eric, this is why a lot of autistic people use closed captioning when they watch videos or when they watch movies, because that allows them to process everything visually as opposed to trying to process things visually and auditorily at the same time. And again, this is another reason why it's not, a lot of autistic people prefer to communicate visually, communicate via text, or it's nice for kids if you have things like visual schedules so they can just look and not have to try to process what you're saying. So another thing is eye contact. You know, people are always talking about, you need to teach autistic kids to make eye contact. Well, that's not actually helpful. A lot of autistic people, because of these processing conditions, they can either give you eye contact or they can pay attention, and you need to choose which one you want, because if it's not actually necessary to make eye contact, even though it's socially desirable, and for a lot of people it's not necessary to understand what's going on. So echolalia is another thing that means scripting. So a lot of times people will talk to you using movie quotes or quotes from books, and anybody who's ever been quoted Caddyshack at in various contexts knows that people who are not autistic do this too. But a lot of times with autistic people, this can be a form of functional communication so that they don't have to think about stringing all the words together. They can just grab their set phrases, use that, it works, everybody's happy. Another one is really important is dyspraxia and apraxia. That means motor processing. So, for instance, a lot of times autistic kids and people who don't speak, it's not, again, because they don't understand what's going on. It's because they actually have an apraxia, a motor control issue that prevents them from being able to speak. And so in those situations, you need to make sure they have the correct communication supports to ensure that they understand what's going on and they can communicate correctly. And this is also why things like applied behavioral analysis can be problematic, because they rely generally, I don't know, again, if you people know what this is, because I don't know the audience, but can be problematic because if you have an actual motor control issue, then you're not going to be able to respond to something that's like touch nose. Like you can hear that they say touch nose, but you can't do it. And so that's related to motor process